Good afternoon, and thank you very much for attending this session of today's ALS Summit, which is Nutrition and ALS. I am Kayvon Freeman, registered nurse and care services coordinator at ALS Association. I also cover ALS clinic at Mount Sinai and also hospital for special surgery. Before I introduce our speaker, please make sure that you write your question on Q&A, and then the speaker will answer as many as we have time for it. It's my pleasure to introduce our speaker today, Sharon Head, who is a registered dietitian and nutritionist. She completed her master's degree at the Case Western Reserve University and her internship at Louis Stokes VA Medical Center. She's currently a clinical dietitian at VA Hospital and taking care of the nutrition needs of veterans with spinal cord injury, multiple sclerosis, and ALS. Sharon, thank you so much for joining us today. And please, thank you.
Okay, thank you for the introduction. Very happy to be here. So I'm going to pull up my slide deck and get started talking about the role nutrition has with ALS. So to start off, let's talk about the importance of nutrition. So one, it can help slow down the breakdown of muscle. As we know with ALS, we see this kind of insidious weight loss and loss of muscle. So nutrition can be a powerful tool to help slow down that breakdown of muscle. It also can keep your immune system stronger, can help fight fatigue and infection, and can be a really powerful tool when it comes to quality of life and well-being. Nutrition has a huge role on the way that we think and our mood and our feelings. So it really goes beyond just being a tool to help prevent weight loss and can have a lot of other multifaceted benefits. So what challenges do we see specifically with nutrition in ALS? So there's quite a lot. The first one being decreased appetite, which can be for a multitude of reasons. Another thing that we see very commonly in ALS is excessive salivation or this sensation of thick saliva. We also see shortness of breath as a very common symptom. And not surprisingly, if it's challenging for you to take in enough air to breathe effectively, it can be really challenging to get in enough nutrition and to complete a full meal. We also see constipation as a very common complaint with ALS. And this one's kind of like a double-edged sword. So, you know, if you're suffering from constipation, it really makes it hard to have an appetite and want to eat. But then also if you're not eating enough, that can really worsen or create constipation because you simply don't have enough food in your body to get things moving. Another thing that's pretty common, and I think actually one of the most one of the most important challenges that I see with a lot of my patients are these last two. So one being adjustment to routine. So what I mean by that is oftentimes as we get further along in ALS, things that maybe took us just a few minutes before in our day, you know, whether that be showering, getting dressed, getting ready for the day, now can take significantly longer or, you know, just be a lot different than how we used to do things. And something that, you know, used to take us 20 minutes now can take us, say, an hour and a half. And that really cuts back on our time with other activities. So that simply can be, you know, the time that we have to eat our meals, the time that we have to think about what we want to eat. It also can cause a lot of frustration or kind of this rushed sensation, like, wow, that just took a lot longer than I would have liked it to. I kind of just want to skip lunch, or I kind of want to just rush through this meal. And while those may seem like small things, they really can add up over time and cause changes to the way that we eat and the way that we fuel our bodies. Also, mood is a huge, factor when it comes to the foods that we eat and our desire to eat, our appetite. So conditions and feelings such as depression and anxiety, whether those be, new things we develop with the diagnosis of ALS, or maybe conditions we had prior to the diagnosis of ALS that maybe come kind of more forward to the limelight when we're dealing with, a diagnosis such as ALS. Those two conditions or any sort of mental health challenges can really impact our desire to eat, our motivation to eat, and, kind of the mental energy we're willing to devote to planning our nutrition and figuring out our meals. So more logistically too, in terms of challenges with ALS, we see this muscle weakness, right? We know that we're going to experience muscle atrophy or muscle wasting with ALS just by nature of the disease. So this muscle weakness, when we're talking about nutrition, can really manifest in our ability to grip things, so our hand strength. And that directly impacts our ability to, grab foods, to cut foods, to hold utensils, and then to lift those utensils to our mouth. So those things are direct challenges to our ability to take in enough food and to, effectively consume that food. I also want to highlight the changes that we see in our swallowing ability, which I focus on, further down in the slide deck. But we see this weakness in our ability to swallow and also to chew. So our jaw muscles may weaken a little bit or fatigue easier, making chewing foods kind of more fatiguing and more challenging and just different and difficult. Fatigue too is a big challenge when it comes in terms of nutrition, because if you're feeling, a little tired or, flat out exhausted, it's really difficult to, again, devote that mental energy to figuring out what you're going to eat that day. And then, just actually physically consuming the food. Another thing that is a challenge in ALS is malnutrition and weight loss. And this can be, again, of course, for all sorts of reasons. But something that is unique to ALS is that certain patients experience something called hypermetabolism. And what hypermetabolism is more or less that your body now needs more calories, more energy to sustain itself than it did before. So someone may tell me fairly often that, listen, I've been 150 pounds my whole life, and I've always eaten the same 3 meals every day, and I've always been 150 pounds. I'm still eating those 3 meals, and now I'm losing all this weight. So basically what they're saying is, the amount of food I ate in the past seems to no longer be enough. What's up with that? And it might simply be that now their body needs more fuel than it did before. And they don't exactly know why this phenomenon occurs in ALS. The last research I found on it was that they think there's actually a change in our cell function with ALS, and specifically our mitochondria, that makes us need more energy just to sustain ourselves. So of course you have all these challenges that kind of make eating a little bit more tricky and difficult to begin with. And then also on top of that, you may just need more calories in general. So next I want to talk about malnutrition, and malnutrition is actually very common in people with ALS. So I want to highlight how important it is to detect these eating challenges and intervene as early as possible. It's really easy to kind of let these things kind of slip away from us. So you might simply be like, oh, you know what, I'm going to skip lunch today. And then that turns into, oh, I've skipped lunch 3 times this week, to, oh, I've never eaten lunch and it's been 6 months. So something like a small habit change such as that can really, cause a lot of weight loss over time. So it's really important, again, to just be aware, to be, thinking of our nutrition, to not let it fall to the wayside. And then of course, regular follow-up with physicians, dietitians, we definitely are going to keep eyes on that as well. And the reason we're so concerned about this is that weight loss, dehydration, and malnutrition can worsen muscle loss, can worsen our respiratory abilities, decrease quality of life, and again, impact our bowel regularity. So if we are not fueling our bodies to our body's satisfaction, it can really cause a lot of problems down the pipeline and make things a lot more difficult or worsen things. And so then on the other coin, if we fuel our bodies efficiently and correctly, they can really help us in a lot of ways. So we can really improve our quality of life, improve our bowel regularity, and, maintain our muscle loss and maintain our respiratory abilities to some extent, at least not put us in a worse position. So it can be a really powerful tool that, for the most part, we do have a good control of. So talking now about studies that have looked into this, right? Studies have found that greater than 10% weight loss at the time of diagnosis of ALS was related to shorter survival time. They also found that each 5% decrease from our usual body weight was correlated with 34% increased risk of mortality. So these are, real statistics that find that, losing a couple of pounds is definitely not the goal. We want to maintain weight as much as possible because it is linked with worse outcomes. And study authors have concluded that early placement of feeding tubes increases survival time. And I have quite a few slides dedicated to that topic, but I wanted to just throw that out there right now with the study slide. So I just kind of went through this long list of potential challenges, right? But what can we do about it with nutrition? What are some interventions that we have? So I'm going to go into each of these topics in a little bit more detail. First being adaptive eating equipment. So when I was talking about how we see this muscle loss that really impacts our ability to grip things, hold things, feed ourselves, is there anything we can do to help with that? And in fact, there's quite a lot. And I want to mention too that I work very closely with occupational therapy in my clinic to help figure out, what exactly someone could use and what could help them in terms of adaptive equipment. But for example, here on the top left, we have an assortment of different style cups. Some of these cups control the amount of liquid that we take in with each sip or each gulp. So by controlling the amount of liquid we're getting, we're preventing ourselves from kind of over-serving ourselves and potentially taking in too much fluid that we can't handle. We also have cups that have lids on them, to just prevent spillage in case something should topple over. We also have some with big cutouts that make it a bit easier to put closer to our face. Bottom left, we have something called a plate guard, which is exactly what it sounds like. It's something that goes around a dinner plate, and it makes it a bit easier to kind of, shove your utensil into it and use it as a guide to help feed yourself. Top right, we have different types of utensils. So there's lots of different types of utensils. There's some that are curved in shape. There are some that are weighted. There are some with bigger handles. For example, like a bigger handle utensil will make it that you don't need to apply as much pressure, closing your hand. So it can make it a bit easier for some people to, still feed themselves. We also have different types of cuffs that can go on your hand that make that eating a little bit easier as well. And then, of course, in the middle is the very, very fancy robot, which is a self-feeding robot, which could be used in some cases. I have had some people tell me it's a little bit awkward, but it's designed to help promote, independence when it comes to feeding. And then moving forward to texture changes and swallowing changes. So the medical term for trouble swallowing is dysphagia. And I have this graphic here, which on the left shows a cross section of just a normal swallowing situation. So as we see, we have these two pipes going down the throat. One pipe goes to the lungs, one pipe goes to the stomach. In this normal swallow graphic, you can see that there's kind of a clearly defined separation between the two, which is meant to be so that we don't get food or liquid into our airway, because that's not something we want. And it's something that can, in fact, cause a situation called aspiration pneumonia. So on the other hand, in this other graphic, we can see someone that has swallowing difficulty or someone that has dysphagia. We can see that there's not as clear of a distinction between these two pipes. So in this situation, it can become a lot easier for food, liquid, even our own saliva to accidentally go down that pipe that goes to our lungs. And the reason, again, this is dangerous is because of aspiration pneumonia. Also, due to choking risk and things like that. So the reason why this happens is due to the muscles weakening a bit in our swallowing muscles. So some things that we can do about this is modify the type of food that we eat to make it a little bit easier to control the food or the liquid that's in our mouth and control it to go down the right pipe to our stomach. I want to highlight too that the symptoms you would experience if food was going down the wrong pipe, probably all of us in our lives have experienced at one point, which is kind of like this like coughing sensation, you know, feeling like choking a little bit. And, you know, often someone will just say, oh, food went down the wrong pipe, something went down the wrong pipe. And that's exactly what's happening. However, sometimes there is no coughing sensation. And in that situation, we call that silent aspiration. So you don't always erupt into a coughing spell, but, you know, if you do notice that you cough quite a bit after drinking something, that might be a sign that you're experiencing the symptom of aspiration. So moving forward, what can we do to modify these, you know, the foods and drinks that we eat to make them safer? So one, I have here the one that I commonly use. It's called Simply Thick. Simply Thick is a thickener that we put into our liquids. And the reason we're thickening our liquids is to help them kind of go a bit slower when we're swallowing. And again, if we can control something by making it go slower, we can control it to more effectively go down that right pipe that we want it to our stomach and not to our lungs. So it's a tasteless, you know, product that you put into all your liquids. So that's water, coffee, milk, tea, etc. And that can help with controlling that swallow and preventing that aspiration. In terms of foods, what we want to do with foods is have them softer and moister. So if you're at the, you know, early stages of this and you're not really noticing, you know, any signs of aspiration or coughing or choking or anything like that, the added benefit too of keeping foods softer and moister is the benefit that you're not expending as much energy on chewing the foods. So again, it's something that we don't really think about until, you know, you have to, but simply chewing can be kind of exhausting, you know, especially if you're having weakness in your jaw and your muscles are kind of getting a little bit weaker there. So having foods that don't require as much chewing is a good decision. And the way that we kind of call these different types of diets, we actually have names for them. So one would be like soft and bite-sized, exactly what it sounds like. You want to keep your meals and your foods soft. You want them to be cut up into bite-sized bites. The other term, moving a little bit more, you know, more advanced, would be minced and moist. So in that situation, like in the second picture, we see kind of like the broccoli and the carrots, all that is cut even finer into a minced situation. And then the most, you know, cautious of all would be a pureed diet. So in that circumstance, we would want all the textures and all the foods to be a pureed consistency. Again, this is to promote safe swallowing and prevent aspiration, and to also conserve energy when it comes to, you know, your own chewing experience. So moreover, like how to eat and swallow safely, it's easier said than done, right? A lot of us have a tendency to eat very quickly. It's just the way of the world, right? We all just kind of chew and swallow and we're talking, and, you know, before you know it, the meal's done in the past. So you might have to just kind of really work to, you know, rewire your brain a bit, you know, take a bite of food, chew it slowly, taste it, swallow it, think to yourself that you're swallowing. So it really can be a little bit of a mind game at first to just simply slow down. You also want to avoid anything that's super dry, hard, sticky, fibrous. The ones that immediately come to mind would be something like a celery, or, you know, of course, like toffee, like, you know, chewy candies, things that are kind of tricky to swallow for anyone. So it's better to just avoid those foods for safety reasons. Some people may find that avoiding foods with seeds and skins would be helpful. I'm going to talk a little bit about the role of saliva in the next slide, but that's another thing sometimes that can make swallowing a little bit more challenging. And then a big one too is to just sit upright when you're eating, and for 30 minutes after eating. It really promotes just gravity helping you out, and then also helps digestion. So that's just a win-win altogether, to sit upright while eating. Don't be lying in bed or in a recliner or anything like that. So in terms of thick saliva, this is a really really bothersome issue for a lot of my patients that I work with. And I want to first start off by saying there is no evidence that dairy causes thick saliva or increased saliva. It does not. But if you specifically find that dairy is like coating your mouth and making it feel, you know, more bothersome, then by all means trial removing dairy. I would just say, and of course, if you remove the dairy and you feel better, then keep removing dairy. But I would just say there's no actual research that dairy makes that worse. The most beneficial thing you can do when it comes to nutrition to help with this thick saliva is hydration. You know, a lot of us don't drink enough water. A lot of us too, especially if you're having difficulty swallowing, can, you know, put hydration to the wayside. But hydration really is a huge, huge part of this that we can, you know, effectively treat if we drink it enough. You know, maintaining appropriate oral hygiene too is very important. So rinsing your mouth out before meals, you know, maintaining brushing your teeth and so on. Also, a saline or baking soda rinse sometimes can be helpful to do occasionally or like before and after meals. And some strategic ways to actually achieve these goals. So drinking a full glass of water every time you have medication or with each meal, after each meal, can just be, if you just can get that into your routine as something you do, that can be an easy way to make it a lasting change that you're going to drink more water. You also want to avoid like alcohol containing mouthwashes, tobacco, and too much caffeine, as those are dehydrating and could make the sensation worse. So there's plenty of like non-alcohol containing mouthwashes if that's something that you like. And also, you know, sucking on ice chips or sour foods sometimes can help, depending, you know, if you're having thick saliva, sometimes that can help with the sensation. And I just want to highlight again some more soft and moist food choices, because I throw this word around a lot too, or this term, soft and moist. Keep your food soft and moist. And sometimes it's hard to actually imagine like what is soft and moist. So here I have some examples of foods and like a common substitute, because I know some foods, you know, so for example, example one, T-bone steak. If you're someone that loves a T-bone steak, how can we make this softer and moister? Choosing something similar, choosing like a Salisbury steak instead. I know they're not the same thing, but it's kind of the same vibe. So choosing foods that are just kind of naturally in the way that they're prepared, softer and moister. So instead of a shrimp, a flaked salmon, a baked potato, have a mashed potato, fried eggs, have poached eggs. Instead of a handful of almonds, have almond butter, something like that. So, you know, you're not necessarily having to, you know, do anything crazy in the kitchen, modifying your foods. If, you know, you can just choose foods that are inherently softer and moister. So, of course, I had to show a graphic to demonstrate that. That doesn't necessarily mean foods are going to be unattractive or foods are going to be, you know, not something our whole family can enjoy with us. There's plenty of foods that, like I said, are kind of in the way that they're supposed to be made. They meet this criteria. So I don't want it to feel like it would have to be like a massive sacrifice for anyone. Because at the end of the day, it's all about just making sure we have foods that we enjoy, that are fueling our bodies, and that are safe for us to chew and swallow. So now let's get to nutrition supplements. So here I have a whole gamut of supplements. And what I want to emphasize about supplements is that they are simply that, supplements. They are never meant to replace whole foods. Whole foods offer us so many benefits outside of just, you know, the calories and the protein. They have a lot of properties that have synergistic effects in our body. They give us vitamins, minerals, fiber. A lot of supplements simply give us, you know, quick digesting, quickly accessible calories, quick dense sources of protein. So I just want to say that whole food is always superior. However, we recognize that with something like ALS, sometimes it's all about just having something convenient that is, you know, not harmful, that can help us gain weight or be used in tandem with a high calorie diet. So we have plenty of supplements available that are ready to drink supplements or that are powder supplements that you can make your own beverages with. There are supplements that are specifically for protein, specifically for high calorie. There's some that are, you know, low carbohydrates, some that are vegan, you name it. They've invented it by now. So I, of course, like I was just talking so much about the benefit of whole foods. Here are some of my favorite, you know, high calorie high protein whole foods. And again, whole foods offer so many benefits just by all the different properties involved in them. And they're, of course, cheaper for the most part. Those supplements can be very expensive. And, we don't need an additional financial burden when we have so many other things going on with, ALS. So if we can find some whole food sources, that's a great way to go. So some of my favorite ones that I almost always recommend, whole milk Greek yogurt. And we say Greek yogurt because Greek yogurt has substantially more protein in it than a regular yogurt. I say whole milk because that means it has whole fat. It can be really challenging to navigate the grocery store nowadays. So something like yogurt, there's 5,000 different types of yogurt, but, making sure that you grab one that's whole fat because in recent years, there's been a lot of push to, lower fat products for most people, but with a condition like ALS where we want to gain weight, we want calories, we want the full fat variety of anything that comes in a full fat variety. So that also goes for good old fashioned whole milk. Whole milk is a great source of protein and calories. There's been a transition too, of course, in recent years to 50,000 different types of nut milk. There's nothing wrong with, an almond milk, but if you're someone that wants to gain weight and wants the most bang for your buck, a whole milk will give you that over something like an almond milk that's mostly water. Avocados, of course, dense source of calories, olive oil, almond butter, peanut butter, and then even things I have at the bottom like coconut milk, coconut cream, those can be really great to use in different soups, smoothies, stews. And then something even like hemp seeds or flax seeds or chia seeds. Those are, really dense sources of calories and protein that pretty easily can be sprinkled onto oatmeal, yogurt, a smoothie, you name it. So something like that are very, I'd say, obtainable, easy to find ingredients that aren't wickedly expensive. But again, supplements do have their role, but I just wanted to highlight that there are foods that are just as great and just as powerful as those supplements. So let's talk about feeding tubes next. So the most common type of feeding tube with ALS is a PEG tube, which stands for percutaneous endoscopic gastrostomy tube. So a PEG tube, as we see in this picture, is going to be on your stomach. So I want to emphasize as well that there is nothing that would show that you have a feeding tube to anyone, if you're wearing clothes. So they're on your stomach. There is nothing on your face. There's nothing on your nose. And they're one of the most effective means of proactive intervention to maintain our body weight and hydration. So what that basically means is this is one of the most effective things that we can do early on to set us up for nutritional success and kind of plan ahead and set us up in a good spot. So not many things in ALS you can necessarily prepare for to the amount of that you can prepare for, the nutritional challenges that you may face. So again, this is something we can do early on, or at least think about and decide on early on that can maybe really help us out in the future. So who is this best for? When should you start thinking about it? So to sum it up plainly, if you're unable to maintain adequate intake, and what that basically means is you are not able to get in enough nutrition that your body needs. And we would know this by, if there was hydration concerns, if your urine's very dark and concentrated and, you're not hydrating enough for whatever reason, if you're losing a lot of weight because you're not eating enough for, again, whatever reason it may be, if we no longer find it safe for you to swallow. So I did mention all those, texture modifications, like the puree diet, the minced and moist. Sometimes for some people, it does get to a point where just nothing by mouth is going to be able to be taken safely. Of course, in that circumstance, in order to get nutrition in safely, you would want to consider a PEG tube. But something important to say is while, you do want to think about this as early as possible to decide if this is something you would consider that's, aligned with your goals of your care, but it's best to get this done and to decide on it before your lung strength declines and before your nutrition declines too much. And the reason why it's important before your breathing declines too much is because this procedure is, I want to say for the most part, very, low complication, fairly simple. Usually it's kind of, you can go home the next day, or sometimes people, even if you come in early enough, can go home the same day. I'd say usually the next day. But if your breathing capabilities are significantly impaired, this becomes a much riskier procedure. And in terms of nutrition as well, if your nutrition has significantly declined, it can be very challenging for your body to, it's just going to be a slower process, right? We're probably not going to gain as much weight back as we would like. You also probably have become, like your stomach has probably gotten a little bit not as accustomed to as much volume in it. So it can be a little bit of a slower process to get you to where we want you to be in terms of, what we're putting through the feeding tube. And then also, and like I said in the first slide, anytime you're not really eating enough over a long period of time, it can really affect our immune system. And of course, while this is not a hugely invasive procedure, if we do have a very significantly impaired immune system, we do put ourselves at risk for, making it a bit more risky of a procedure. So talking about studies that have looked into kind of the benefits of feeding tubes and supplements, and I'll summarize the slides, it's a little bit busy, but one study looked at people with ALS, and they looked at giving them a nutrition supplement. And they found that 61% of people with ALS had their weight stabilize or actually gained weight when they were taking a nutrition supplement. So those were like the Boost, the Ensure, and so on that I had on that slide. They also found that 77% with a PEG tube had their weight stabilize or in fact gained weight. They also found that 85% who got a PEG tube stated they had an improvement of quality of life after they got the PEG. And no people with ALS said their quality of life deteriorated or got worse after they got the PEG tube. So I think those are two very powerful statements. I myself, of course, I'm just one clinician, but I have never had a patient tell me that they regretted getting a feeding tube. But I found it really interesting that this study found the same thing, that these individuals actually said their quality of life improves. And I'll talk about why I think that's so on the next slide. But this other study, again, found that early placement of a feeding tube increased survival time in individuals with bulbar onset ALS. And then this last study I'm highlighting just really emphasized that quality of life evidence strongly supported a PEG tube as a palliative intervention for ALS patients. So again, just highlighting that studies have also looked into this and found that it's a very powerful tool that we have. So frequently asked questions. The big one is, yes, you can still eat with a PEG tube. This does not impact your ability to eat. It's just a tool to have if your ability to eat should become impaired. But getting a feeding tube does not directly impact your ability to swallow, to eat what you want, and what have you. So if you get this feeding tube on early enough, you don't even have to use it for necessarily nutrition. You can put your medications through it, you can put fluids through it, or you can just put a small supplemental feeding through it. So instead of, say, drinking a Boost shake, you put something equivalent to a Boost in the feeding tube. However, you can also meet 100% of your nutritional needs through the feeding tube. So say, things start to decline and you really feel like you can't eat by mouth anymore, we can cover your nutritional needs through the feeding tube. Or say that, an acute situation happens where you're acutely ill and you just really don't have an appetite. We can then use it 100% through the feeding tube for a little bit. And then if you get better, cut back. So it's really flexible. It's a really, really flexible tool. So it can really improve quality of life. I want to highlight that it really gives power back to the person with ALS, especially if you're someone that did struggle with eating challenges for a while. So, you're no longer sitting struggling to perhaps eat a meal. It kind of gives you power back to you because you can eat whatever you feel like by mouth. And once you feel like you don't want to eat anymore, we can cover whatever else you may need through the feeding tube. And formulas for, putting through the feeding tube are recommended by a dietitian, and we take into account your individual needs, your calorie needs, your protein needs, your medical history, and everything like that. So they're very individualized, and you can also be very individualized with the method of feeding. So just like a thinking tree here. So we know that ALS can cause eating difficulty. So we know that ALS therefore leads to weight loss. we know that we can alleviate these symptoms with a feeding tube. And we know that there's an element of time sensitivity with placement of the feeding tube. So, my thought is, would you feel better knowing you have the feeding tube just in case? And what are your individual goals of care? And what could you focus on more if the barriers associated with eating were removed? So I've had plenty of people tell me that, a donut that they used to eat in like 5 minutes now takes 20 minutes, half an hour. What could you do at that time, or what could you focus on in life if it wasn't the struggle of eating, and if meals didn't take so long? So that's just another thing to think about. So like, again, summarizing benefits of a feeding tube, it can alleviate your or your caregiver's stress around eating. You don't have to necessarily constantly be thinking like, oh my gosh, I know I'm losing weight. What am I going to eat for lunch? Oh my gosh, I just ate lunch and now it's already time for dinner. You don't necessarily have to worry about this thing. So it's time and energy saved. And like I said, it gives control back to the person with ALS in terms of when to eat, how much to eat, and it takes the emphasis away from the struggle, perhaps, of eating. So again, too, usually people start to find that eating takes forever, and they'll tell me, eating is a chore. They'll tell me, I don't even want to eat. I feel like I'm chewing forever. It's just not enjoyable. And if you have a feeding tube, you can eat to the, level of enjoyment. And then once you're over it, you're over it. And we can use the feeding tube to supplement for the rest of those meals. So logistically, what does it look like to feed yourself with a feeding tube? There's 2 methods. So the most commonly used is this one on the top right, which is called the bolus method. And that's basically taking a can of formula, you pour it into a syringe, and you kind of hold the syringe up and it flows into the feeding tube, into the stomach. So typically the way we would write this would be, that you would bolus 2 cans, 3 cans, 6 cans through the feeding tube. And we would separate these bolus feeds based on your preference and your schedule. So, just using a syringe, and it's kind of like you just do it when it's time for a meal, and when it's not time for a meal, nothing's happening, is kind of a summary. On the other hand, lesser used, but an option is a feeding pump, which is very similar to, like, if you're familiar with an IV, there's a bag that hangs on it, there's a pole, and there's a little machine. And we set that up to give you kind of this continuous infusion of a feed. And it doesn't necessarily have to be continuous while you're awake. So a lot of my patients run this overnight. So they will connect to their feeding tube when it's ready to go to sleep. They will be fed while they're sleeping. They wake up, they disconnect, they eat whatever they feel like during the day. So that is technically an option as well. And what I have here on the bottom are just examples of different types of formulas. They're definitely not the same as the ones you would take by mouth. These typically don't have any like flavor to them because, you're not necessarily tasting them. So they're specifically designed with the feeding tube in mind, also in terms of like viscosity. We don't want to put anything in the feeding tube that would potentially clog it or make it like less sanitary or clean. So now let's talk about just nutrition emphasis, going back to just foods we're eating by mouth. So what's recommended for ALS in terms of just foods we're eating by mouth would be a high calorie, high protein diet. Again, nutritional supplements as needed, but food first. Small, frequent meals, which can be helpful for decreased appetite and, symptoms of like fullness or constipation. Small meals, but like more often. Hydration is very important. And realistically, our goal is mostly to maintain weight and, promote weight gain, though I will say it at a certain point can be very challenging to gain weight back that we have lost. But of course, if we can achieve that goal, we'll do it. But even just maintaining your weight is a very huge win nutritionally. So some tips for helping weight gain. Don't drink beverages before meals, because what this does is, if you are about to sit down for dinner and then have a big glass of water, we're kind of filling our stomach up with the volume of the water. So I just say drink beverages after meals if possible. Definitely not, you don't want to avoid beverages to the point where you're dehydrating yourself. I just say timing wise, try to have them in between meals or after meals. Same thing goes with carbonated beverages. Those two, sometimes the bubbles can fill up our stomach and make us feel kind of full. And the goal is obviously to not feel too full because we want to be as hungry as possible for our meals. Again, if you're on supplements, take them apart from meals. Don't have Ensure with your breakfast. Have Ensure after breakfast in between meals, because again, you'll fill up on the Ensure and you will not eat as much of the food. Switching those high-fat varieties of foods. Focus on foods that have, high nutritive value. So we still want to focus on our fruits and vegetables and what have you, but all foods fit. If you're at the point where your appetite is very, very bad and all you want is a Big Mac from McDonald's, as a dietitian, I'm never going to tell you that you can't have that, because we're at the point where we just want as much nutrition as possible. But of course, healthy foods are still very important. So research into diet. So studies in mice have found a protective factor of high fat, high calorie diet. So they actually can induce ALS in mice. And when they do so, they found that those that restricted their calories decreased their survival time. So basically, they lived longer if they followed a high calorie, high protein diet. In human trials too, prolonged survival time in fast progressing patients following a high fat, high calorie diet was found. So they found that, again, there is evidence to support this style of eating, and there is evidence to support that if we're restricting our calories for whatever reason, that is going to harm us. So, again, nutrition can help us or it can harm us. So it's something we can't just stay neutral to. We have to try our best to make it something we're focusing on. So let's talk about the benefits of each macronutrient. So macronutrient is, there's three. There's carbohydrates, there's proteins, and there's fats. And all of our foods fall into a mixture usually of the three. So carbohydrates are beneficial because they have vitamins and minerals in them. A lot of our carbs, especially here in the US, are fortified or enriched with B vitamins, with iron. They also have a lot of fiber, which can help with bowel regularity. Carbohydrates are immediate energy and our body's preferred fuel source. So our body likes carbs. A lot of us probably don't have to have me say that out loud. We know that we naturally like carbs. There's a lot of carbs in our food system, in our diet. So choosing whole grains when possible is going to give us the best benefit for that bowel regularity and for the vitamin and mineral content. And then when it comes to protein, as I said, I've kind of been emphasizing this during this presentation, how important protein is. It's important for muscle retention. It's our muscles' preferred fuel source. We need enough protein in our diet to maintain muscle mass. It's also very important for production of antibodies and for skin and hair health. And fats are our densest source of calories and the smallest amount of volume. So basically, they give you the most bang for your buck when we're talking about calories. And they also provide fat-soluble vitamins, or help us absorb our fat-soluble vitamins. And they also provide us essential fatty acids, which are very important for our cells in our body, our skin again. So typically, I'll break into each examples of each of the following, but a big one that's pretty easy to increase in our diet are fats. Just because, like I said, our food system over the years has kind of like removed a lot of fat from our diets by promoting like low-fat products. So simple switches to a higher fat product can give us a lot more calories for a smaller volume. So here are some examples of naturally very rich sources of fats and healthy fats. Because we probably also have I won't dive into this because it's a whole other thing, but there's different types of fats. Typically saturated fat is deemed as the lesser healthy, but these are examples of healthy fats. So avocados, nuts, seeds, salmon or fatty fish, olive oil, flaxseed, etc. Proteins. So of course, we all know meats have protein, poultry, pork, beef, also fish, also beans, protein powder, eggs, tofu, nuts, and beans also are plant-based sources of protein. Greek yogurt, which I highlighted, is a dense source of protein. So it doesn't necessarily have to be, of course, that you're eating meat with each meal, but trying to include these plant sources of protein can also help meet that protein goal. Carbohydrates, like I said, we're all very familiar with carbs, I think, for the most part, but choosing whole grains when possible. And they're also a good opportunity to add fats. So something as simple as having toast, taking the opportunity to really load that toast up with butter or cream cheese, or if you're having crackers, have the crackers with cheese, have them, you know, with hummus or a spread. So you want to take those carbohydrates and pair them with other things to make them more nutritionally dense. Fruits and vegetables, I wouldn't be a dietitian if I didn't bring these up. So, you know, they're really important for micronutrient benefits. They also have quite a lot of fiber in them. And what I would say is really just find preparations that you enjoy and play around with them. They're really great, even if you're someone that doesn't like vegetables. You can, you know, puree them and put them in soups. You can put them easily in shakes and smoothies. I promise you can't taste them. I recently actually had someone make me a smoothie with an avocado in it, and I didn't think I would be able to taste it, and I wasn't able to taste it. So again, just an example of you can throw these in things and they can be pretty invisible if you follow, you know, a recipe. So ways to manage decreased appetite. Again, these are kind of more habitual things to do, but eating in a relaxing environment, trying to make your food look presentable, including favorite foods, avoiding low calorie foods that don't really serve much benefit, at least when our goal is weight gain. And then just maintaining an eating schedule to stay accountable. So this is something that's been very helpful in some of my patients as well, is to make sure that you are, you know, holding yourself accountable to eat foods at a certain time. So don't just let yourself, you know, go hours without eating. If you kind of make yourself a schedule at 8 a.m., I'm eating something, 10 a.m., I'm eating something. It can just be a way to kind of just get it done. So I'll just kind of quickly go through these slides, but these are examples of ways to take foods that you might be eating and use the tools I mentioned to make them a little bit more calorically dense. So something like Cheerios, if you are used to having those with just a 1% or a skim milk, adding them with a whole milk or something of that nature. And then lastly, I'm just going to wrap it up by talking about the benefit of smoothies. So building a balanced smoothie, this is a great opportunity to add in a lot of calories, a lot of protein, and then also add in some vegetables to get those other benefits. And with that, I have wrapped it up. So I hope I didn't go too far over. I will pause my sharing.
Well, thank you so much. It was so thorough and honestly, I think you answered all the questions that I can read here, but I will just take some of them. So maybe you could just give a little bit more answer to that. One of them about this Ensure. I know most of the patients, when they go to the clinic, they always advise them get extra Ensure. Would it be one of the best, or is there any other substitute for that?
Yeah, so and usually the ones that are recommended are the ones that those hospitals have direct contracts with. So for example, at my facility, we have a contract with the company Abbott, and therefore I'm most familiar with Ensure products. However, some hospitals are contracted with Nestle, and that's a Boost product. Most of them are very nutritionally similar. So I would not say necessarily that Ensure is superior to a different product. I would even argue that if you take whole milk and make yourself a smoothie with whole milk and peanut butter, you can make something very similar to Ensure.
Yeah. Another question is, I think, is the weight distribution. Does it change during the ALS? Like, for example, is mostly centering to the waistline?
Yeah, so unfortunately, this is a common thing I hear as well, is a lot of patients will tell me, listen, I've lost all this weight, but I feel like my stomach is bigger than I'm used to, and I don't think I need to eat that much anymore because I see this, like my stomach doesn't necessarily look aesthetically pleasing to me anymore. And I totally empathize that there's all these changes happening in ALS. That's one that can be really bothersome. But typically what happens is our muscles, again, are atrophying. So even sometimes those transverse abdominal muscles that are a bit deeper in our abdomen that hold in our gut normally can also weaken. And therefore it kind of can make this appearance of our stomach perhaps protruding more. Also, again, a lot of times, since we are losing that muscle mass through, the destruction of our motor neurons, we're seeing our muscle mass atrophy. We are accumulating more fat mass in relation to that. Though I would argue that, if we can get past that mental barrier, nutrition can help us with so many other things. Again, like our respiratory health is huge. So I just would, recommend to wear clothes that you feel comfortable in, that don't highlight those areas that you feel uncomfortable in, and just think of those other benefits that nutrition is giving you outside of just the aesthetics.
Excellent. So I know you touched base about protein, fat, and calories, but if you had the choice and you had to choose one, which one you think is more important in ALS?
So hard to say, right? Because all
hard.
of those together are really necessary. You cannot have a diet with just zero fat in it. You would develop fatty acid deficiency. Though I will say again, with ALS, if we have no protein in our diets, we are going to lose our muscle mass drastically faster. And we know that ALS, the disease, is going to try to destroy our muscle mass. So if we're not eating enough, we're just saying, okay, make that process happen faster. So I am not picking, but I will say out of all of those, I usually highlight protein as very, very important for that reason.
Okay, that's great. So you talk about feeding tube, that if you do have a feeding tube, you still can eat by mouth as long as you can, and it's not going to make you cough and choke, and of course, aspiration pneumonia, then you will stick to the feeding tube. But as far as you're safe, you feel safe, you can have both.
100%, yeah.
Right. So another question is, do you feel full as a result of feeding tube when you eat you have feeding tube, you feel full like faster than if you had by mouth? And also, what is the effect of bowel habits when you have a feeding tube?
So there's a lot of reasons that you might be feeling, if someone does say they feel more full after getting a feeding tube than they used to by mouth. One, it can be like a lot of times we're getting a feeding tube once we've already lost a lot of weight. And while this isn't for everyone, but we do sometimes experience that our stomachs shrink a little bit, or they're just not as accustomed to handling the proper amount of food. So sometimes there can be an adjustment period. There's also a lot of different types of formulas, and some of them we can tweak to help with those feelings of fullness. So some formulas have fiber in them, getting to that bowel health question. Sometimes having a formula that has fiber in it can really help with bowel movements and improve them. But also for some people, it can cause them to feel a little bit more full, or perhaps even bloated. So we can play around with the amount of fiber in the feed to find like a happy medium. Also, sometimes the method of feeding. Some people simply can't handle a whole can of feed at one time. For some of my patients, I recommend half a can. They wait 30 minutes and they bolus the other half, and they've found that helps.
That's great. And somebody wanted to know about the fruits and vegetables. What is the benefit of that and versus?
Yeah, so I don't have all the super concrete evidence of it in ALS, but you guys are probably familiar with things like turmeric use in ALS, or even like B12 in ALS. And again, I don't have the quotes on the actual research, but these are properties that are found in a lot of fruits and vegetables. And outside of even that, again, a huge topic that I won't necessarily go into, but the health of our gut is really influenced by the types of fruits and vegetables that we have. So when we're thinking of our body as a whole, these fruits and vegetables provide us a lot of anti-inflammatory properties, a lot of vitamins and minerals that are working in the background to support us and improve our overall health. In anyone, but also with ALS, they can really help with inflammation, which may, help. One day we'll see all the research on it, but I can't necessarily quote it right now.
Okay. So, of course, we know that feeding tube can get expensive, especially if insurance doesn't pay for it or whatever. So I'm asking, what happens if we have the homemade food liquid and put it in the tube? Is it advisable or no?
So I do not typically recommend that. Dietitians, if that's something that is very important to someone, we can work with you and provide, the best ways of doing it. The two main concerns I have is, one, with a formula, we can say exactly what's in it. If you're having a bad reaction to something, if you're not gaining weight, I can see exactly what we're giving you. If we're doing it at home, it's hard to say exactly what we're getting unless you do the same thing every single day. You're more at risk for deficiencies. And there's also the element of the main actual ones too outside of that are one, you can clog the tube a lot easier and no one wants to go in and get their feeding supervised. Two is the bacterial concern. I mean, perhaps if you're pureeing things like protein source. I did once have a patient that used to grill his steak still, and he had a high-tech blender and blended them up and put them in the feeding tube. But of course, then there's that risk of, was the steak, contaminated with anything? Was it cooked sufficiently? So it just kind of introduces a little bit more variables, but there are ways to do it, but I would definitely recommend to work one-on-one with a dietitian that can make sure it's nutritionally adequate.
So bottom line is you advise them not to use the homemade.
Yes. That's what I would recommend. Again, mostly too, just because of the risk of clogging the tube. These formulas are specifically designed to not clog the tube. I mean, it still sometimes can happen, but you're much more at risk if you're making your own food at home for clogging the tube. There's also even some formulas nowadays that use whole foods. So if that was the concern, there are formulas that have whole food ingredients.
Okay, so since you mentioned about blocking the feeding tube, what would be the best course of
action if the tube does get blocked?
Yeah.
So what can be helpful is to put warm water, flush warm water into the tube, let it sit undisturbed for a while, and then see if you can kind of like plunge out the blockage. There's also even certain like unclogging agents that you can like purchase. They're called like, they're specifically designed for that. So if that is something like, you just have like a big fear of, it might not hurt to just buy some of those products. Also, just good old baking soda can mix with water can also help unclog the tube.
How about ginger ale or 7-Up or Pepsi?
So that's another one that's kind of like not really recommended anymore, just because we're a little bit concerned with like the acidic nature of that. I mean, I know that in the past, like a lot of nurses and stuff were trained to unclog it with that. I just say like officially, it's not really recommended.
Thank you. Okay, the last but not the least, what about if somebody wants to put alcohol in the feeding tube? Can they do that? Or
that's another one I've actually been asked for too. I would not recommend that because also too, you have to think you're putting it directly into your system. Something that you may have tolerated at some point might really cause your blood alcohol level to shoot up. We don't want anyone to be dizzy and fall and set themselves back. So I wouldn't recommend, unfortunately.
Thank you so much, and it was wonderful. It's really so informative. Unfortunately, we are running out of time. And if you have more questions, please just send it to us. Somehow we will get the answer and get back to you. The next session will be 6 p.m. and that is 30 years of genetics and ALS. And that will be with Dr. Hom from Columbia Presbyterian. Thank you so much, and thank you. Bye, everyone.